A pleasant good day, everyone, and welcome to this public health update on COVID-19. I am Phil Neptune. Today we have with us a team to have a discussion on COVID-19 in terms of where we are right now and how we are managing this COVID-19 wave. With us today we have the Chief Medical Officer, Dr. Sharon Belmar-George. We also have the National Epidemiologist, Dr. Francois, and the Assistant Principal Nursing Officer, who's also the Immunization Manager, Tecla Baptiste. This broadcast is live via the National Television Network, also the Government of Saint Lucia's Facebook page and the YouTube channel. First, we will start with a presentation by the National Epidemiologist, followed by the other persons in the panel, and then we'll take a few questions from the public. First, we turn on to Dr. Francois, who will provide us with a situation update in terms of where we are right now with COVID-19 in Saint Lucia.
Thank you very much, Ms. Neptune. A pleasant good morning to all. Globally, there have been approximately 160 million cases with over 3 million deaths. What has happened over the last few weeks is that there has been a slight decrease with over 5.5 million cases and 90,000 deaths. The highest numbers were from India, followed by Brazil, the United States, although they did indicate a slight decrease in cases, and also Turkey, which also indicated a slight decrease in the number of cases being presented. Within the region, including CARPHA member states, there have been roughly 750,000 cases with 500,000 recoveries and approximately 10,000 deaths. This does not represent a significant number compared to the rest of the world. However, but for small islands like ourselves, which are highly dependent on tourism, these numbers are quite significant and may impact how we move forward in terms of a tourism destination. From this graph, it really shows the 7-day moving average among CARPHA member states, so that is within our region. And what I would like you to pay particular attention to is that each subsequent wave has increased. Over the last few weeks, we had noticed a plateau in the number of cases. However, as of May 14th, we have started climbing in terms of the number of cases. Now, with the circulation of variants within the region, within the world globally, with WHO now declaring another variant of concern in India, this is particularly concerning as we have started increasing, and we know that some of our member states have at least 3 variants to date. The following is our national analysis, which we do on a weekly basis to follow certain indicators which guide how we move our public health measures, when they should be relaxed and when they should be tightened. So we have had to date 4,871 cases. Over the last 28 days, we've had 414 cases. This is of significance to us because if we look at the CDC travel, the guidelines indicate that over 100 cases is considered very high risk. So we pay particular attention to this because we need to know how we are classified and how we can adjust our measures to ensure that we are not in the criteria of very high risk. In terms of our daily infection rate, we have moved from 11 to 10.9. It's a very insignificant number. However, it really demonstrates that our number of cases on a daily basis is constant. So we've had almost 20 cases a day, and this is between May 5th to May 18th. We've averaged 20 cases a day, and that has not changed for the past 14 days, sorry. If we look at our 14-day average, we have gone from 12.6 cases per day to 19.8. So in terms of that, we have moved from April 21st to May 4th, from 6.9 to where we currently are at 10.9. So there is some increase in activity in terms of the number of cases being diagnosed on the ground. And in terms of community transmission, if we go by the Centers for Disease Control, what we notice is that we are now at substantial transmission. In terms of the total new cases per 100,000, substantial transmission would be 50 to 99. So we are not moving in the correct direction. We have been increasing cases, and this is of concern, particularly with the new variants of concern that have been diagnosed. Our average testing positivity for the last 7 days is 8.8%. The World Health Organization recommends a positivity rate of under 5% for countries to determine whether they should adjust their national protocols in terms of strengthening or relaxing these protocols. And this should be at least 5% for 14 days. And we are currently at 8%, though we have gone down at least 1%, but it is significant, and it is something that we need to pay particular attention to in terms of adhering to our protocols and our public health measures. When we look at the persons being affected, 53% of all cases have been female, and this has been consistent for the past 2 months. The age group which is mostly affected is our 25 to 49 age group, which represents 53% of the cases. However, our ages have ranged from the very young to the very old, 11 days to approximately 100 plus years, with an average age of 38 years. When we look at our analysis by school age, we have broken it down nicely, and our school age has been 9.5%, and that is really in keeping with regional and international standards. Since we have reopened schools, our numbers have not increased. We have been managing cases in schools, and it is something that we do expect. We do have community transmission in Saint Lucia. Many of the homes would have young children who would be affected either by adults, their guardians, or older siblings. So it is not unusual for us to detect cases in classes. We have been working very closely with the Ministry of Education to ensure that there is not any further transmission or serious outbreak in the schools. So contact tracing is done in the same manner that we do it for workplaces, in the same manner that we do it for the rest of the community. And those who are considered most at risk, they would be quarantined and tested and followed up in a timely manner. Our deaths, we have recorded approximately 71% of them being male. That itself too is not unusual, and it is a trend that we do see in the wider community. Men generally, we have found, especially in St. Lucia, tend to have poor health-seeking behavior. They tend to go in really and truly when they cannot stand whatever discomfort it is. So 71% of our COVID and COVID-related deaths have been men. And the age group most affected has been our 50 plus. We have found also within the deaths that the majority of persons did have underlying medical illnesses, such as diabetes, hypertension, or the combination of the two. We have also noted renal failure as an underlying medical condition, and this is not too surprising, as both diabetes and hypertension can lead to some level of renal involvement. Our prevalence by health district. When we look at the number of cases, which is the bars that we see, Castries has accounted for the majority of cases. However, Babono, when we do a prevalence based on the population of the different regions, Babono has had the highest incidence per 10,000 persons, which is followed by Ancillary, and grossly. We have also noticed increases in the cases in the south of the island, particularly Vieux-Fort, Dennery, Micoud, and Labrie. And these are areas that had previously reported few cases. So now we are seeing an increase in the numbers in the south, and we are working, our public health team is working on the ground to ensure that these numbers do not increase further. So this is our spatial distribution of COVID-19 cases for the period April 4th to May 15th. This is our distribution by months. And what we notice here is that the majority of our cases from the beginning of the epidemic in Saint Lucia has been in January and February. So the beginning of the year was when we had our most cases. And the numbers dwindled through our public health measures, dwindled in March and April. However, in May, midway through May, we are noticing that we are almost at the number that we have in April. So this is particularly concerning. We are midway through the month of May, and we have almost reached April numbers. So hence a call to the public to practice social distancing, to ensure mask wearing, wash hands, and at least try our best to maintain these public health measures in order to reduce the number of cases that we are seeing in country. In terms of our cases, our analysis by our EpiCurve, we have demonstrated a 7-day moving average, which really accounts for, we've grouped the 7 days, the number of cases for 7 days, and taken an average. And this is done to ensure that we do have significant discrepancies from one day to the next. And it accounts for the late arrivals in the lab turnover time, etc. So as we can see, as with the previous slide, our numbers were significantly high in January and February. It came down in late February to March. We had a slight spike, and you can see these isolated cases were attributed to cases at our correctional facility. This was addressed and have since returned to normalcy. But what I want you to focus on is that we are at an increase in terms of the number of cases. We are very early on. We have noticed, as I said, in the south and areas in the north, and we do expect that with the measures put in place, the public health measures put in place, we do expect to see the numbers go down. Particular caution should be placed in persons in our everyday affairs within the workplace, to not let our guard down, to ensure that we do the necessary, whether we're boarding a bus, we're going into the workplace, into the schools, into a healthcare facility. COVID-19 is maybe asymptomatic. Persons may not necessarily have signs or symptoms, or they may be very, very mild. So it is not possible to tell who has COVID, be it your friends, your family, your co-workers. So to all, kindly ensure that we practice these public health measures in order to curb the increase in the numbers that we are seeing of COVID-19 on island. Thank you.
Thank you, Dr. Francois. And of course, you mentioned that we have seen an increase in the cases, which is of concern to Saint Lucia. And in your presentation, you also mentioned the variants, which is of concern. I now turn on to Dr. Belmar, who will speak on the variants in terms of the implications and also the impact of the variants. She'll also speak on the risk of the increased cases and how is Saint Lucia going about managing those cases.
Thank you very much, Ms. Neptune. Good morning to all. As we noted, with COVID-19 being a new viral illness, a lot of the forecasts that were done based on the nature of the virus, it was estimated that COVID-19, the impact of it would be for around 2 years. So based on the public health estimates, it was expected that by the middle of 2021, we should be seeing reduced curves, reduced impacts on most countries. However, as with many viruses, there is the capacity to mutate, that is to change, and also to change the characteristics of that virus. And this is what we are seeing with COVID-19. The variants of concern we've been hearing about, and every day there are new variants coming on, some of them of less interest and some of them having greater impact on the population. So those which have greater impact, we refer to them as variants of concern. And there have been hundreds of variants of COVID-19, but the main ones which we speak about are those which are variants of concern. And the implications of those variants include an increase for transmissibility. That is, for every one person who gets it, there's a greater likelihood of other persons getting it around them. The capacity for more severe disease is also noted, and we also see a reduced capacity in terms of the drugs, the therapeutics that we use to treat persons with the disease may be less effective. There's also the implication on a reduced efficacy of the vaccines that have been produced for the various, the different variants that we note. And in some cases, you may even get a reduced capacity to detect, since the PCR testing is what is more effective in identifying the virus. So there are many implications based on the number of variants that we are seeing coming up. In terms of a summary, the main variants that we note, the B117, which is the British variant, the B1351, which is the South African variant, and the P1, which is the Brazilian variant. These are the three main variants of concern. WHO has just recently added on the Indian variant, as you note what is happening in India. For us in Saint Lucia and our implications, I will look to the AstraZeneca vaccine. It is very effective against the British variant, which is the variant which we have identified circulating in Saint Lucia, and also for the Brazilian variant is still expected to work. In terms of the South African variant, it is not sure how effective it will be, and we are waiting on data to see how effective it is. So this is why the variants have now put a whole new twist on what was forecasted for COVID-19, and why for us as a country we need to ensure that we maintain a lot of the public health measures that have been advised, because the impact on countries which are managing variants, as we see in Trinidad, as we see closer to home in Martinique, the impact that it has on those populations. We note we were managing one variant with our third wave in January, and we saw the difference in terms of the number of cases and also the number of COVID-related deaths. In terms of the countries which are more likely to affect us, our very close neighbor Martinique, they're managing three different variants of concern, the UK, South African, and the Brazilian variant, and you're aware that they're now managing a major outbreak within their system. Our other countries which we rely on tourism and our returning nationals is the UK, Canada, and the US. They're also managing quite a few variants as well. Based on our analysis of our contact tracing for Saint Lucia specifically, our risk for introduction of both new COVID-19 cases and also the introduction of variants depends on three major factors. The high risk in the international tourism markets, which was shown earlier, the illegal entry of persons from countries of high risk who roam in our communities. We are aware of the situation, the illegal entry from Martinique into Saint Lucia, and they're managing community spread with three variants presently, and the non-adherence of our returning nationals to home quarantine. The risk for community transmission, the non-adherence of visitors to hotel protocols, the reduced use and poor use of face masks in public places, the increased mass crowd events noted across the island, the non-adherence to established protocols at business places, and the crowding of public buses without mask use. Dr. Francois very clearly indicated what our epidemiological curve looks like to date as we've managed 3 waves, one small, one medium, and one very big. And when we review the various measures, we know what works, and that is specific to our country, Saint Lucia. As we release, as we've been seeing over the last few weeks, the increase in social activities, and from our contact tracing, we note that the areas where we see the increases in cases, where we're getting most of the cases, are in the areas with increased social activities starting up. I think for us now, and the intent today is really to alert the public, ensure that everyone is aware of where we are at in relation to COVID-19, to alert the public on the increased trend that we note in our epi curve. Previously, we were managing with a rate of transmission of 1.1. We have gone up to 1.54, and we see the upward trend towards a 4th wave in country. We are at a very critical point, and we want to ensure that everyone is aware of where we are, and our actions at this point is really going to determine how we continue to manage. We can end up getting to a major outbreak, as we are seeing happening in the rest of the world. So this is really for the public to be aware of where we are, a level of our personal responsibility. There's been a general relaxation of the measures during the month of May. I think if we all take an honest look around what's happening on the ground within the communities, the social activities, and there are specific areas which we have flagged and picked up the outbreak of our cases. There are certain services that are higher risk, where we get more cases when there is one detected. So it is really important that we as a country do what is necessary. We take personal responsibility to ensure that we protect ourselves and our family. Dr. Francois also made a very important point when she showed the data in terms of the age groups affected. We have not seen an alarming increase in cases, or even a barely increase within the school population. We manage cases at school, but we have not had any outbreaks. We expect to get cases here and there at schools, which we have seen. Out of abundance of caution, we have tested and quarantined classes when necessary. But the Ministry of Education has been managing very well the safe reopening of school, and it has not been a concern for the Ministry of Health, the few cases that we have managed at schools. The high risk remain our social activities, and we see it especially on a weekend in various locations, and these are the same communities that we note the wide increases in cases. At the level of the Ministry of Health, we utilize and we review guidelines and recommendations from a wide range of public health agencies, from the CDC, from WHO, from PAHO, from CARPHA, and there's a lot of regional discussion into which recommendations are best applicable per country. We've noted the CDC's recommendations, where in one section it indicated that once persons are fully vaccinated, they can stop wearing their masks. They don't need to physical distance. There's a wide range. I think most persons have seen a lot of those articles. We also use other public health agencies as well. In this same document by the CDC, they also guide on what is known about fully vaccinated persons and the introduction of variants. That being said, I just want to make it very clear what we use in terms of giving recommendations. We review a very wide range of guidelines that are put out and updated very frequently. However, whatever guidelines are put out, it has to be applicable and best suited to the country. We, for example, in Saint Lucia, when you look at our immunization rate to date, it is still below 20% as compared to the country which the CDC guidelines, for example, are prepared for. We also look at the culture of our citizens in terms of their capacity to comply to public health regulations. We also look at the capacity to enforce those regulations, to see what the impact and how effective those regulations will be in curbing this infectious disease. So one measure may be very effective in one country. We have a Caribbean island who utilize our COVID Act. It was very well implemented, well enforced, and they have done very well, whereas those same measures here, depending on the capacity for compliance, implementation, and enforcement, may not necessarily be as effective. And we've also seen that in another Caribbean island who's similar to here, having lots of issues in terms of compliance. So it is really irresponsible that we not only look at the guidelines, we review all of the guidelines, and we also look at our country-specific situation in deciding what is the safest way in moving forward. And this is what we always do in terms of how we move forward and how we manage cases. So I just want for the public to be very cognizant of where we are in relation to managing COVID-19 and to ensure that we do everything that is possible in terms of the public health measures so that we reduce that trend that we are already seeing, this upward trend, to reduce the possible impact at this point. Thank you.
Thank you very much, Dr. Belmar. Part of dealing with the COVID-19 pandemic, in order to fight it, we had the COVID-19 vaccine. So I now call on Nurse Tecla Baptiste to speak on the vaccination program as to where we are right now with it.
Thank you, Ms. Neptune, and good morning, Saint Lucia. Well, the COVID-19 pandemic has continued to affect us locally. We see the impact of the COVID-19 virus regionally and globally. Of course, as part of the fight against COVID-19, we have seen the development of safe and effective COVID-19 vaccines. A public health strategy, we hope, that will help bring an end to this virus, to this deadly virus. We have, of course, seen the effect of COVID-19. We've seen how it affects lives, how it continues to affect us both, health-wise and the economy. And as such, we are encouraging persons to continue to access the COVID-19 vaccine. I will provide an update on the COVID-19 vaccination campaign. Of course, we know that Saint Lucia started its campaign some 3 months ago, actually exactly 3 months ago, 17th of February. As of yesterday, the 17th, 26,609 persons, that is 14.7% of the population, would have been immunized with the first dose of the AstraZeneca COVID-19 vaccine, whilst we have about 17,053 persons. This accounts for about 9.4% of the population that have been fully vaccinated with 2 doses of the vaccine. I must say that it is important, especially when it comes to 2-dose vaccines with 2-dose regimes, it is very important that persons receive both doses of the vaccine in order to achieve the highest possible immunity from the vaccine. The Ministry of Health, of course, we are pleased with the response, especially during the very first phase of the rollout of the campaign. The uptake, of course, it continues, especially we are very satisfied with the uptake of the second dose. The first dose uptake continues, but of course at a slow pace. We continue to encourage persons to access the vaccine. Of course, persons accessing the sites and accepting the vaccine, that tells us that we understand the benefits of vaccine. It is through vaccination that we have eliminated many vaccine-preventable diseases, and COVID-19 is no different. We know that for the past 3 months, the focus of the campaign initially was really on reaching out persons who are at very high risk. We had moved to persons at medium risk. But as of the 3rd of May, the campaign has transitioned from this phased approach, and of course, we are now targeting everyone who is 18 years and older. The government of Saint Lucia, of course, remains committed to ensuring that the vaccines are available and it's accessible to the entire population. At the start of the campaign, of course, we received a generous donation of 25,000 doses of vaccines from the government of India in phase 1. We also had generous donations from our sister islands in the region. The government of Saint Lucia continues to procure vaccines. We know of the COVAX facility. For that mechanism, Saint Lucia, of course, has received two batches of vaccines amounting to 50,400 doses out of the allocated 74,400 doses from the further COVAX facility. We expect the third batch of vaccines, which is 24,000 doses, sometime in early June, either the first or the second week of June. The government of Saint Lucia also has procured 100,000 doses of vaccines just to ensure that vaccines is available and is accessible. And that shipment of vaccine we expect very soon. Of course, our aim is for us to get to that level of coverage, for us to reach population immunity. We would like, our target is to achieve at least 70% coverage, and we have a target of about four months to get to that. I mean, it is very important for us to return to some level of normalcy, and of course, it can't just happen this way. We know that public measures such as wearing our masks, keeping our distance, our physical distance, ensuring that we sanitize, this alone is not enough, and it is important that the majority of our population has this level of protection, get vaccinated, have that level of protection that will take us to a point where we can regain some level of normalcy in our lives. Like any program, of course, the vaccination program is continually assessed to identify any gaps, any areas of concern, and of course, for us to, we re-strategize and we implement new measures to correct whatever issues or whatever gaps that we would have identified. One such area of concern, of course, we noted was that of the slow uptake of the vaccine, and as such, the Ministry of Health has decided to ramp up its community vaccination outreach, and that is to include the mobile pop-up vaccination clinics that would have commenced from last weekend. So from last weekend, we are now moving. We are actually, in addition to our regular vaccination sites that are ongoing throughout the weeks, these mobile sites will be going into communities So we actually bring vaccination to the people. And we're targeting high areas with high traffic, especially on the weekend, the Fridays and the Saturdays. So from last weekend and moving on, you will be seeing these mobile pop-up vaccination clinics at various high traffic areas across the island. So of course, we continue to encourage persons to access those mobile clinics when they are in your area. All of this is towards 70% population immunity, and of course, achieving normalcy. Thanks.
Thank you very much, Ms. Javatis. And we've heard from the panel, and we spoke about the increase in cases. But before we move to the question segment, perhaps Siamul can tell us what is Saint Lucia really doing? What is Ministry of Health doing to prepare for the increase in the cases?
Thank you very much, Ms. Neptune. The Ministry of Health, what we're doing is an intense review of every single aspect of the response to COVID-19. The last wave, we noted that there were certain gaps in our response, there were certain delays in the response, which affected how the rate at which we were able to bring down the curve. So we have managed a full wave. We saw where the gaps were, be it from human resource, from equipment and supplies. We got delays sometimes in testing. So we've done a critical review of the various aspects to ensure that as we prepare, as we note increases in cases, our response will be a lot more effective. And we continue to ask the public that health and safety needs to be the priority. One of the issues which we note, for example, with the school reopening, and this is one of the things we need to address. If someone is in quarantine or isolation or a suspect case, the kids of that person should not be sent to school. This is one of the issues that we're noting in the few cases we've had to manage. So parents need to know when to keep your kids home. If you are on quarantine or isolation, we ask that you stay in. You should not be out exposing yourself to other persons. We continue to ask persons to wear your mask, avoid large crowded areas. We still have too many active cases in country to allow the numbers we see at funerals, at receptions. We notice there's a lot of socializing within the bars, within the communities. Those are the areas where we are seeing the high number of cases coming up. So we continue strengthening the response on the part of the Ministry of Health. We continue providing information, as Nurse Baptiste indicated. Immunization and vaccines continue to be one of the most effective public health measures in managing infectious disease. So we are really asking the public to get vaccinated. Encourage your family, your friends, your co-workers. The sooner we get to at least 70%, it means our population will be a lot safer from the more severe forms of COVID-19, especially given the implications of the new variants. So we really need a level of personal responsibility. We want persons to look out and care for your loved ones, your friends. Take them to sites. We are making it's free of charge, it's accessible, it's in the communities close to you. Make this a priority so that we can really get back to normal, as our new campaign's slogan says for vaccines. We need to take our life back. I think that's what it says. Take your life back. Let's get back to normal activities. And we really need to do that for all of us and our family, especially those with high risk.
Thank you very much. So, of course, the Ministry of Health is saying that although we will be putting measures in place, we're asking that the public also adhere to the protocols. We'll now be taking a few questions from the public and the media. Persons can call at 468-2162. The first question we're going to take is from the media. It's a question from both Nisha Charles and also Nilma Shalmine from Choice TV. The question is, does the Ministry of Health plan to provide incentives to persons as it relates to vaccination?
Okay. One of the strategies that we note that's being implemented in different countries is providing incentives and benefits to immunization. We have met with events, Saint Lucia, looking at the opening up of events, and that's one of the incentives in terms of allowing an increased number of activities for fully vaccinated persons. So this is one of the strategies. The chamber and the tourism sector, they have put a plan in place together with events, and we are hoping to meet them this week to discuss an incentive program so persons can get added benefits, I should say, because we know the vaccine prevents you from developing severe forms of disease, hospitalization, and death. But added incentives for social activities, added incentives in terms of other services that persons can access when they're fully vaccinated. We are working with the private sector to incorporate this into our immunization campaign.
Thank you. We have a call on the line.
Hi, good afternoon. Hello.
Hello.
Hi, good afternoon. This is Janika Simon from the Virgin Islands Consortium. I think there's a little bit of a delay, so I'm just going to speak through. I hope you're getting my audio. I have a couple of questions for Dr. Belmar-George. CMO, I am wondering whether there is, or what is the position of the Ministry of Health right now as it pertains to reducing quarantine requirements for fully vaccinated travelers who are coming in, that is both visitors and returning nationals. And relating to the quarantine issue, what stage are the discussions at with the cruise passengers to maybe allow them to actually patronize the port shops at La Place Carnage and at Point Seraphine? If I am correct, I think right now they will be limited to going on bubble or approved tours only, which means that a lot of retail shops and employees who have been without revenue for a year plus are missing out on the return of the cruise ship. So those are the two parts of my first question.
Okay, thank you very much for that question. In terms of the cruise travel, the Ministry of Health and the government of Saint Lucia are in discussions with the cruise sector looking at the safe return of the cruise sector into Saint Lucia. And the model we are looking at is quite similar to that used by the tourism sector, where it will be a bubble, quite different to what is regularly seen with the cruise sector being able to freely roam. So they would be allowed to go to approved sites and attractions. In relation to Point Seraphine, as far as the discussion has been, is that Point Seraphine being the ship's berth there, that they would be a part of the sites and attraction. The difference would be is that on the days when the cruise ships come in, locals would not be allowed to access the shops on that day. So this is a discussion that is happening, and the Ministry of Tourism is liaising with the various sectors to ensure that all of the necessary protocols are put in place. In relation to the second question for fully vaccinated travels, there's been extensive discussion both at the level of our regional public health agencies and countries as to how we manage persons who are fully vaccinated coming in and how we could adjust some of our quarantine time to fit. We are aware that vaccines protect persons from extensive disease or the severe form of the disease, but what is not fully known is what is the rate of transmission of COVID-19 for someone who is fully vaccinated. We have noted that some countries have adjusted their quarantine time from 48 to 10 days. So we are discussing, looking at what the possible risks are. We are still in the discussion phase on that to ensure that whatever recommendations are made, a proper balance of health and safety, and to reduce the inconvenience that the 14-day quarantine has put in place. So a lot of research is still being done. We await information on what the transmission of COVID-19 for someone who is fully vaccinated is. As usual, we look at the data, we look at the research, and we provide recommendations and discuss, ensuring that whatever risk is put, and there's always a risk in every measure that's put in, that the country is able to manage that risk in a very safe way to reduce any impact that it may have on the population. So although we see what is happening in the region, if the changes, we continue the discussion and the dialogue to ensure that a safe measure is taken moving forward. Thanks.
Dr. Belmar-George, my second question is on the gaps and challenges that you mentioned a while ago. There are numerous reports that I am getting, that my colleagues are getting, about serious lapses in the contact tracing system and efforts. People are being tested positive. Their contacts are not being called. People are being asked to violate their own medical privacy by calling, the health officers are asking them to call their close contacts themselves. People are being told to, take public transportation after testing positive, to go to their place of, quarantine or isolation. In any of the gap identification that you have done, has there been a request to central government for more funding, to have more personnel in the contact tracing system? I do not know if it is a technology issue. Can you speak to that specifically about what is going wrong there and how is the ministry putting things in place to address that?
Okay, we're reviewing every single aspect of our response, but I will allow the National Epidemiologist Dr. Francois to provide some insight in how the contact tracing works and where some of our gaps and issues are.
Okay, thank you for that question. We do welcome the questions and the comments as a means of improving our services to the public. That being said, let me just go through what contact tracing entails. So an individual who has been exposed or is symptomatic would go into a wellness in any one of our respiratory clinics to get swabbed. That individual would be sent home. We don't know the results of the test yet, but that individual would be sent home and placed in isolation until the results are available. And if they do come back positive, this is when the contact tracer now responds to that individual. So a call is made. The individual is asked about their contacts. They are asked to provide a list of who they have been in, and we explain to them what a contact is. So in terms of the distance, in terms of mask wearing, how long you have been you were in contact with the individual. So a definition of what a close contact is given to that individual, and they are asked to prepare a list of persons who we would need to reach out to. We can only contact persons that we know of. So when we get that list, we contact the individuals and let them know that they have been in contact with or exposed to a case, to COVID-19, and they are asked to quarantine, and we give them a date where they need to get tested. What may happen at times is if we ask the individual if they have any objections to persons finding out who they are. So normally in contact tracing, we do not reveal, we let you know that you were exposed, and we don't necessarily tell you who you were exposed to. If there is a need for your name to be given to an individual, we ask you first, would you kindly inform the individual if you would like your name, because we would not want to be the ones to give your name to an individual. So if you do wish that we use your name, we ask you to inform the individual. If not, we simply explain to contacts that you have been exposed to COVID-19, and as such you are required to quarantine and test on a given day and complete your 14 days of quarantine. So as indicated by the Chief Medical Officer, we continue to review. We welcome your comments and the questions from the public as a way of improving. But the short answer to your question is we can only contact persons who we have been given. Now, you have a lot of times where persons give their work contacts. They don't give their social grouping, and there's still a lot of stigma, unfortunately, attached to COVID-19. So persons you find tend to omit or forget, I really don't know which it is, their social contacts, or sometimes they are fearful for their jobs and they tend to omit the names of individuals simply because they do not want us reaching out and they do not want persons to know. We try as much as possible to ensure and to reassure persons that their names will not be communicated to their employers unless permission is given. So a lot of times it is actually the individual. If permission is given, they are the ones to inform their employers. A similar situation happens in schools. If a child tests positive, the parents, normally we don't even have time to call the parents. As soon as they receive results, they alert the schools, and so we do the contact tracing based on what the information that we are given.
Okay, I just wanted to clarify the point that you're making. Do you believe that there needs to be any additional resources on the contact tracing team, or are you saying that it is well resourced and it is the people who may be not providing the necessary information to reach everybody?
We have had instances where we do not have the necessary information. As with the last wave, we did see a significant increase in the numbers, and so our capacity was stretched. But as it stands, we rely on what is given to us and try as best as possible to reach each and every contact that has been given to us so that persons test and remain in quarantine, because the aim really is to decrease on the number of infected individuals we have in community. As it increases, so does our workload. So we're really trying to aim to reach every single person, have them tested, have them quarantined. We let them know what date their quarantine is up. We let them know what date to test. Some persons opt to test earlier. They do so, but we also inform them that if you do test early and you are negative, that you need to retest, because there is a period whereby you may get a false negative. So it is a combination of the two.
Okay, thank you.
You're welcome.
Thank you very much. I really appreciate your time. I have one final question for the panel. I note that the lab director, Dr. Saint Lucia, is not here, so I'm hoping that one of you may be able to answer. I noticed that in the past couple of weeks, the daily reports on new cases have come in, and most of them come in batches of taken over about 48 hours or so on average. I am wondering whether there is some sort of minimum number of samples that can get tested in a lab that would result in, okay, I do not have enough samples to run through the machine now, so I have to wait for another batch to come in, or what is causing that 48-hour turnaround in results? Are we having a capacity issue? Is it an operational issue? And is that slight delay impeding in any way the identification, the management of positive cases? Because as we all know, it's a race against time to stop transmission if you have a positive case. So can anybody speak on that?
Yes, I will comment on it. We're using various machines at present. Our capacity is about 2,500 a day for PCR testing for the lab. The reason why we sometimes have a delay, and this is one of the things which Dr. Felicia is not happy about when you hear that 48 hours. The 24-hour turnaround for the lab is really when the sample gets to the lab. We have respiratory clinics at 5 various sites around the island. And one of the delays which we note in the turnaround time is the time at which the sample comes from the respiratory clinic to the lab. As for example, in the clinic in Vieux Fort, at times they would wait for the full day to collect samples. So if you went on a Monday morning to take a sample and it's transported to the lab in the evening, it would most likely get to the lab sometimes the following day in the morning and be run that day. So you get the results in the night, hence the 48-hour period that you get. So we do not do twice a day transportation of samples from the respiratory clinic. So it depends on the time in which it gets to the lab. So when the lab says a 24-hour turnaround, they're really counting the time that it gets to the lab. So most of the time at this point, we have been able to build our testing capacity to manage based on some of the issues we saw in the delays in the last wave. So the delays at which different samples are given is really the time that it gets to the lab.
Thank you
for your time and your answers today, panelists. I appreciate that very much. Thanks very much.
Our next question is from Riani Isidore from NBC TV. The question is, between December 2020 and March 2021, CAFA's lab detected the UK variant of the COVID-19 virus in 15 people, which included non-nationals in Saint Lucia. Has the number of confirmed variant cases been updated, and were there any more variant cases detected since then?
We have recently received confirmation of an additional 7 cases of the UK variant. Right now we are unable to share with the public as to their location, whether they were tourists, because the results comes in from the lab as coded, and so we need to work with the lab to get the identities of the individuals so that we can decipher whether they were nationals or visitors to the island.
Great. We also have another question in regard to variants. This one is from Kiba Tiliam from RCI. Referencing the number of variants and the implications of reduced efficacy of vaccines, what does this mean for the management of COVID-19 using vaccines? Will new vaccine treatments now have to be created?
Like I indicated in the slide earlier, we note that the new variants for some of the vaccines, they're not as effective. And what it has meant for Saint Lucia and all other countries where we were hoping that with the vaccines we can immediately drop all of our public health measures, we are not able to do that just yet until we get to herd immunity, that is population immunity of at least 70%. There's a lot of research happening now looking at how long the vaccine immunity is going to last, and also on other drugs that could possibly be used to treat COVID-19. So we are looking at it. We have to use a range of measures. The vaccines we know, and the AstraZeneca that we're using in country, it's very effective against the British variant, which is what we have identified here in Saint Lucia. It just means that at present, until we are able to get to a safe coverage for our country, we have to maintain the public health measures that are in place.
Thank you. The next question is from Phoenix from KNC Radio. It's in regard to the virus. The Indian virus numbers have gone down, and because of the use of ivermectin and also the hydroxychloroquine, To such effect, why is the import of this drug or any other drug been disapproved here?
With the advent of COVID-19 being a new virus, from the beginning, when many countries saw the impact that it was having on the health of persons, from those getting very sick, requiring ventilation, there was a lot of experimentation happening, looking to see what would be most effective in, first of all, reducing the signs and symptoms, reducing the impact to severity, reducing the hospitalization time, reducing the possibility of someone being ventilated, and all of the complications. One of the early drugs that was used was the hydroxychloroquine. Now this is Plaquenil. It's a drug which is used to treat collagen vascular diseases such as lupus, rheumatoid arthritis. And initially they started using it, especially for persons who were within the ICU setting. After a few months of utilizing it, what came out was the adverse effects that it produced. The research showed that it was not effective at treating viral illnesses, it was not effective at reducing the time on ventilation, and even the complications. What was noted, some of the side effects of the hydroxychloroquine were arrhythmias, heart disease, the effects on both the liver and the kidney. So the side effects were much worse than any possible positive effect on managing. So that is why a lot of countries which started, and we also procured in the hope of starting at the respiratory hospital, but based on this evidence which came out through even some of our neighboring countries who used it before us, it was not, I think we did use it initially. We did use it initially, but when we saw what came out of the clinical trials and the research on those side effects, we quickly took it off of our schedule. And the clinical trials which have been done have shown that it is not an effective drug to use to treat COVID-19. In terms of the ivermectin, ivermectin is an antiparasitic that it is used to treat parasites. It's also antihelmintic, and it is used widely for veterinary use. It is one of the drugs which, in the lab, it showed some level of promise in terms of reducing viral replication. In countries which started using it, they too also noted that there is no effect in terms of preventing COVID-19. There is no effect in it being an effective treatment. And for many countries who also started using it in hope of reducing signs and symptoms, prevention, the research has also shown that it is not effective, and the side effects as well were of grave concern. I just want to make it very, very, very clear that ivermectin is FDA approved to treat parasites. It is not FDA approved to treat COVID-19. One of the recent articles, I think that was around May 3rd, which the FDA actually put out, made it very, very clear that they do not approve the use of ivermectin for treating COVID-19, and there is no effect on preventing or treating or curing or reducing complications. And for us at the Ministry of Health, we, especially for our vaccines, ivermectin is not a vaccine, it's not a preventative agent. We rely on WHO approval for vaccines. So we would like to have a wide range of vaccines available. For example, the one-dose Johnson & Johnson, we would really love to have had, and we are working to see how we can procure some, especially for our more difficult groups, for example, our homeless persons, persons with mental illness, and persons with fear of needles, so they don't have to get two doses. But our policy is to ensure that any vaccines that are approved on island have gone through the full preventative and safety regulations of the WHO. We've heard a lot of persons asking for other vaccines, such as the Cuban vaccine. as soon as they go through that system, we would be very happy to have it available here on island.
Thank you. We have a caller on the line.
Hello, good day. Hi, good afternoon.
Good afternoon.
Okay, good afternoon to the panel. My question is, I have been watching international news, and I have noticed that they have stopped the use of the AstraZeneca vaccine. And like the CMO just mentioned, they're just trying to get the other vaccines. They're trying to procure. Could you tell us, is there anything we should be concerned about, since Canada has stopped it and other countries, the US is now stopping the first dose? Is there anything we should be concerned about, as you know, since we have gotten our first dose and waiting for our second dose of the same AstraZeneca? Thank you very much.
Hi, caller. Thanks for very good. Well, that's a very good question, and we do note your concerns. Of course, as with any other medication, any other drug, if any side effects or any adverse events or anything serious that would have occurred after someone would have taken, whether it's a vaccine or a drug, it would warrant a level of investigation. We do note some of the articles, and we do know that some countries have stopped the use of AstraZeneca because of supposed events that would have occurred in the population after persons would have taken the vaccines. As I said, in any case, these things have to be investigated so that they could establish or determine causality and to find out whether it's actually associated with the use of the vaccines. As a precautionary measure, some countries have decided that they would have stopped. We know of countries who have recommenced using AstraZeneca. As we speak, over 130 countries still use AstraZeneca, including some very well-developed countries are using AstraZeneca. We know one of the reasons why some countries would have held back or pulled back on the use of AstraZeneca was because of the vaccine-induced thrombocytopenia that is associated with COVID-19, with the vaccine. But I will say that in as much as there has been it has not been established that it is definitive that the vaccine does causes these thrombotic conditions, and of course there's still a lot of investigation continuing in that regard. In terms of the issues of blood clots and those, and as a rare side effect, people continue. There are so many other things in addition to that would cause blood clots or these thrombotic conditions, such as COVID-19 itself. The risk of COVID-19 infection in causing blood clots is very high. We have people use contraceptive use, even obesity. I mean, we know the burden, how much of a risk that obesity causes in our population, leading to chronic conditions, and all of these things does expose someone or puts or put people rather at risk, for blood clots. So for us to say that it is indeed the vaccine that causes these blood clots, this has not been, it has not been established. But back to your question, it is the choice of a country whether they want to continue with the use. I mean, pending the investigations that are going on surrounding the rare side effects. And I will say that the benefits of using the COVID-19 vaccine far outweighs the risk, because the risk of these rare conditions is so small as compared, to the benefits that we get out of the vaccine. We have seen in some of the developed countries and some countries that have been using AstraZeneca for months now, we see the decrease in the numbers of deaths, we see decrease in the numbers of hospitalization, we see decreases in the numbers of severe cases of the virus. So the benefits of using the AstraZeneca vaccine outweighs the risk, and as such we continue to use the AstraZeneca vaccine. As CMO says, we would be happy to have other vaccines available to our population. Clearly we note that a choice of vaccines would be welcomed in our population, and as such we await approval of some of the other vaccines, such as the Cuba vaccine that many persons have been asking about. But unfortunately, the vaccine from Cuba is still going through its phase 3 trials and has not been pre-qualified for use by PAHO, by the World Health Organization. And as such, we are not offering it here. But of course, clearly we know that availability and the choice of other vaccines is something that we'd want. And of course, once they go through the pre-qualification by the World Health Organization, it is something that we would offer to our population. CMO, I'm not sure if you want to add anything.
The only thing, the caller asked, would we advise persons to take the second dose? And absolutely.
Oh, I didn't. I missed that part of the question. Right. I didn't. I honestly didn't hear it. Of course, we would encourage persons to have the second dose, because especially with a 2-dose vaccine, it is important that in order for someone to realize the full benefit, the full protection afforded by the vaccine, it is important that they have both doses of the vaccine. Of course, after one, there's a certain level of protection that the first dose would afford you, but with the complete regime, then you get the full protection from the vaccine. So yes, we would encourage persons to take the second dose of the vaccine.
Thank you. That leads to our next question from Rian Isidore from NBC TV as it relates to vaccination. Has the Health Ministry conducted any surveys on the public perception on vaccination? If yes, when will this information be published?
Ahead of the implementation of the campaign, we did conduct a survey, a CAP survey, assessing knowledge, attitude, and perceptions of persons regarding the vaccine. The results of this has not been published. However, we think there's benefit and there's value now that we have implemented our COVID-19 campaign and we have introduced. I think there is benefit and there's value in assessing the use and the knowledge and attitudes of persons. So it is something that we have been considering, especially from the immunization committee standpoint. So I think moving forward in the coming months is something that we would be considering. And of course, once it is conducted, the results of it will be communicated to the public, will be disseminated.
Thank you. And before we move to the next individual from the media house, the last question from Riani Isidore. The Ministry of Health's COVID-19 reporting practices have changed. The ages, locations, and nationalities of diagnosed cases have been omitted from official press releases in the last few weeks. Why the change?
As we manage the pandemic, the reporting and communication structure has changed from the beginning to this point where we are. If you note, originally we did almost daily updates, recorded updates. Also, as the number of cases increased, initially we would actually put a 50-year-old male from Castries. As the numbers grew to 100, 200, it became exhaustive to put all of this information in any one release. And hence there was a need to now summarize the release and put the numbers. It became too many at one point for us to put in any one release. So that was the main decision, that was the main reason for us summarizing the reports going out. And what we do is the regular updates where we indicate, as the national epidemiologist just did, showing where the cases are coming from, the number of males, the percentage of males and females, so that the public is aware, which is what we do. We put into our reports and updates as a summary form. Instead of doing it person by person, we are now into 4,000. I think that would be very exhaustive to put in any one report. As much as possible, we attempt to provide timely updates to the public so that they are aware of what's happening in country.
Thank you. The last question is from Nelsha from Choice TV. The question is, can you ask whether or not we think that there's a negative impact or implications on the tourism market, given that we have an increase in the cases?
I think this is really a question for the tourism ministry or the tourism authority, but clearly, if I'm going to travel for a vacation, I would want to go to a country where there is reduced infectious disease. So I think that when the numbers climb, apart from the fact that there are various classifications where countries are put into high risk, and anyone looking to travel, you would want to go to a safe destination. So I believe that in any increasing numbers, it does put a red flag on the country, and certain visitors would be skeptical about going to such a destination. So the impact of the increasing numbers would be on various levels for us here.
Thank you very much. Okay, so we've come to the end of the program for today. We have no more questions from the media and the public. I want to thank the panel so much for being here and providing us with this very valuable information on COVID-19 and where we are right now as it relates to managing this new wave. Thank you so much.
Thank you.
On behalf of the entire production team at JS NTN, I am Fernal Neptune. Thanks for watching. Until next time.